Welcome back to my no-name channel. I'm Bruce and this is another Bali COVID-19 update for August 8th, 2021. And, well, good news and bad news today. Let's look at the numbers first. So, new positive cases are down this weekend. And, well, this is a weekend and they're usually down. And we'll talk about that in a minute. The 7-day average for new positive cases is 12,042, and the 7-day average for deaths is gone up to 38 a day. And national numbers, there's 31,753 new cases, 1,588 deaths. Not good. What about testing? Testing yesterday across the country was 144,100 with 22% positive. We're a long way from 5%. And what about vaccinations in Bali? Good news. Here's some good news. First dose, 3,088,593, 72%. And second dose, this is the really good news, 1,083,410, 25%. So we're up to 25% of the population fully vaccinated here. And yesterday there were 32,064 doses administered. Over the past week in Bali, 230,000 doses were delivered. So vaccinations are ongoing here, even though there are some issues, like when I did mine, with social distancing not being a factor there. So what about the numbers for yesterday? 1,027 new cases. As I said, it's down from the day before, and that always happens on Sunday. Recoveries, 1,261. Deaths, 39. And current active cases, 13,302. So our current active cases still way up there. And if you take a look at the charts here, you'll see we've kind of leveled off new cases, and deaths climbed up a little. So that's the not so good news. So what about the new cases in Bali? Of the 1,027 new cases, they're all Indonesians, no foreigners. 880 are local transmissions, 138 are from domestic travelers, 9 from international travelers. And by regency, Denpasar 392, Badung 162, Buleng 132, Tabanan 87, Jembrana 81, Bangli 64, Gianyar 55, Wungkung 32, and Karangasem 20. So, good and bad news with the numbers. Bad news, deaths still up there, climbing slightly. Good news is that the positive cases seem to have kind of leveled out, but they've leveled out a really high number, 1,200 and what was it, 51? So yeah, that's not good, especially considering the high vaccination rate we've got here. Okay, let's go on. So what about vaccines and vaccinations? Well, we have some new vaccinations that arrived on Friday. This was 26,170 vials of the AstraZeneca vaccine, and they arrived at the airport and they were taken by police escort. First to the Ngurah Rai Air Base Operations Facility where they were barcode scanned, and then they were taken over to the Bali Provincial Health Office, which is where they're being kept. Why the police escort? Because these guys were equipped, they were armed. Well, it's because they want to get through traffic, and vaccines are guarded 24 hours a day by the police. So we see we've got some vaccines, right? Yesterday and on Wednesday we had more vaccines, so a few days ago. Getting vaccines from center in Japan. Bali continues accelerating vaccinations. So we got 281,000 doses from the central government and a Japanese grant on Wednesday. And this was according to Ketut Swarjaya from the Bali Provincial Health Office, and I've talked about him many a times. He said that we received 34,100 doses of Sinovac and 247,500 doses of AstraZeneca. And so, good news, vaccines continue to roll in here, and the vaccinations are going on throughout the island. And if you take a look at this graphic, you'll see how just on the island itself, how uneven the vaccinations are. You take a look at Bulaang, for example, and we have 14% fully vaccinated, and then you go down to Denpasar, 56%, Badung, 65%. So we need to get the whole island vaccinated, and each regency, the governors of the Bupatis of each regency are working on getting their numbers up there, and hopefully we'll have this taken care of by September. But don't forget, by the end of September, but don't forget we're an island in a country with 270 million people, and so people come in and they go out. We really need to get the whole country vaccinated. In last week's video, or in the last video, not last week, now I'm doing two times a week, I discussed the arrival of the Delta Plus variant. However, in an update of that news, the head of the Institute for Molecular Biology, Jikman Amin Subandrio, said that there was only one case of infection with the Delta Plus variant in Indonesia, not three, like I talked about last week, and this corrects the previous announcement. According to Amin, it turned out that there were two cases in Jambi, but they weren't the Delta Plus, they were a local variant. He said that Delta Plus already exists, but there's a correction. There's only one case, and it's in Mamuju. Amin is a professor of clinical microbiology at the Faculty of Medicine, University of Indonesia, and he said Delta Plus is basically a variant of Delta. However, the difference is that Delta Plus has an additional mutation in the spike protein. The basic character is still Delta, so it is faster than other variants of transmission. So we're still watching for the Delta Plus variant. Okay, and so let's finish up the vaccination section here with another article. COVID deaths more than 3 times higher for unvaccinated in Indonesia. So recent news reporting about COVID cases among the vaccinated has been used by anti-vaxxers as a reason for not getting their shots. So this news from the Health Ministry shows that vaccinations are indeed important in protecting us from serious illness or death from COVID-19. The death rate for COVID-19 patients in Jakarta who were not vaccinated was 3 times higher than those who were, according to the Health Ministry data. The mortality rate was, for the non-vaccinated, was 15.5% compared with 4.1% for those who received 2 shots of either Sinovac or AstraZeneca, according to the data from state hospitals from May to July, and this included 68,000 patients. According to Dr. Ines Mosucardo, a molecular biologist who works on vaccine development, the data is difficult to come by, the vaccinated versus unvaccinated, but she said the data available supports evidence that the importance of vaccines. And she said this supports the proposition that 2 doses of vaccine reduces the chance of dying for those infected and requiring hospitalization. And separately, data from Banyuwangi during the period of March to July showed that 93% of COVID-19 patients who died were not vaccinated. 93%. 6% had received 1 dose and 1% fully vaccinated. So your odds of living or getting seriously ill are much better if you get vaccinated. With any vaccine. What vaccine is the best? Right now, any vaccine you can get is better than nothing. And I'm going to talk about this more on Wednesday, but the vaccines and vaccinations are obviously not distributed equally in Indonesia. In Bali, we're up to 25% fully vaccinated, but and other parts of Indonesia, the numbers are very thin. And so we're going to talk about that. But according to Irma Hidiana, the public health expert and the co-founder of the Independent Data Initiative Lapor COVID-19, she said the Ministry of Health needs to have a well-planned vaccine distribution that ensures all vulnerable people are top priority. And we're going to talk about the lack of vaccinations in the eastern part of Indonesia, where I've spent a considerable amount of time in my 32 years here. Okay, so I've talked about the vaccines and vaccinations and the numbers. Now, what about if you test positive? What's happening? Well, according to this article, weak tracing efforts, patients refusing isolation, hampering Bali's fight against COVID-19, according to the Indonesian Medical Association. Tracing and quarantine are two issues of the pandemic that are problematic in Bali. So, according to Igede Putra Suteja, head of EDE or IDI, depending on which language you're speaking in Bali, the reality now is that tracing is low. Only 3 to 5 people are traced from one confirmed patient, while the World Health Organization recommends 20 to 30 for tracing. So this is quite hard, right? And the governor said that we're going to bump that up to 8 and eventually get higher. Right now, it's not really functioning. I'll talk about that in a minute. So the governor announced last week, as I noted in my video, that tracing would be ramped up to 8 people per person. Suteja also said that some patients are refusing to isolate, whether on their own or in facilities prepared by the government. He said people fear tracing because it might lead them to be taken to a centered isolation facility that's far away from their home. There are cases of individuals showing symptoms when they are examined, but they don't want to be tested because they fear losing their jobs or having to be isolated. And according to the EDE Bali, the province also struggles with limited supplies of isolation facilities, ICU rooms, and oxygen. A close family friend tested positive this week for COVID at a local puskesmas with the antigen test. He was told to go home and he'd be contacted later. Well, after not being contacted for 24 hours, he contacted them himself and was advised that he could come in and get a PCR test, but there's really no need because he already tested positive. And when he asked about quarantine facilities, he was told that they were full. There was a waiting list and he should just self-isolate at home for 14 days and after that come in and get retested. Nothing about tracing in the conversation, despite the fact that he lives with 5 other people. So that's not a good sign. And more on the quarantine, what happens after you've been tested positive. Multiple COVID-19 patients in Bali were spotted outside when they should have been at home in quarantine. So centralized isolation places for residents who are confirmed positive for COVID-19 are still not sufficient. So there's many who are undergoing self-isolation in their respective homes. While the government works on providing a sufficient supply of quarantine facilities, people that have tested positive for the virus have been told to go home, like I mentioned with my close friend, despite what was officially said 2 weeks ago about not letting people self-quarantine. So there's not enough places. The government's messages are kind of mixed here. We have the places, we're going to quarantine people. Nobody's allowed to self-quarantine at home, but people are being told on the ground to go home and self-quarantine. Is this good? No, because this is where you get clusters. So in the case of this article, this is about Jembrana, and so there were people that were tested positive for the virus in Jembrana, and they were forced to undergo self-isolation at home because the facilities, the quarantine facilities, were already at maximum capacity, and well, they didn't stay home, so they were spotted wandering around the neighborhood buying food. Well, that makes sense. They needed to have food, but they're not supposed to go out. So if you're not going to be in a government facility, be quarantined, if you're going to be at home, you would think that there would be somebody who would come and check on you and bring you things or arrange it with the village leaders to provide you with the necessary requirements of daily living, rice, oil, vegetables, those kind of things. The head of the Jimbrana Police Department, Pak Putra, said that the family of 7 who were supposed to be undergoing self-isolation after 3 of them tested positive were spotted at a local vendor buying food. So Pak Sudarma Putra put a sticker on the house showing that there was COVID cases there to keep neighborhood residents away, probably not making the family very happy. Meanwhile, the head of Jimbrana Health Agency, I Gusti Bagus Ketut Oka Parwada, confirmed that the regional government has provided 348 beds spread out between hospitals, hotels, and schools for asymptomatic patients to monitor them. However, he noted that people undergoing self-isolation need to be more disciplined in doing the quarantine procedures and avoid having contact with nearby residents. Okay, so we've looked at all this, all of the vaccines, vaccinations, the numbers, people who aren't behaving as they should in terms of quarantine and the issues with quarantine. What about opening Bali? Well, as I said over the past few videos, there hadn't been any talk about opening Bali for 2-3 weeks now, as the numbers continue to climb. But news this week from tourist industry players who want Bali open soon or sooner. Tourism analysts urged President to reopen Bali tourism on Independence Day in response to comments by the Coordinating Minister for Maritime Affairs and Investment, Pak Luhut, about gradually opening economic activity in Indonesia next month in September. Bali tourism player Iwayan Puspa Negara said that the government should consider opening Bali even sooner than September. He suggested that we open it on the 17th, Independence Day, as a gift to Bali. So even with the high numbers, the high number of deaths, he wants to open it up in another 9 days. And what were his reasons? Well, he said that several areas of Bali, like Kuta, Legian, and Seminyak, have already met all the requirements for opening businesses and start opening normally. He said all of our tourism businesses have prepared with proper prevention protocols to operate, and they have passed the Clean Health, Safety, and Environment certification process. And in addition to those areas, there are the green areas, Ubud Sanur and Nusa Dua, which he said now have 100% of residents vaccinated. Additionally, he said that the government should revise the 8 p.m. curfew, I thought it was 9 p.m., to 11 p.m. to help restaurants and cafes get more business. And I Putu Astawa, head of Bali Tourism Agency, also wants Bali opened in the near future because he claims Bali's already completed all the requirements for opening up that the central government requires. He said that the airport was ready to receive tourists and proper procedures are already in place to handle an influx of tourists. Will we get an influx of tourists? You know, I'm thinking that when we first open up, and if the B211 is okayed again, yeah, we are. We're going to get some tourists streaming in here, and then after that, I don't know, because from what I hear from friends of mine in Asian countries, in China, in Korea, Japan, Taiwan, they're not ready to come to Bali right now, not with the numbers the way they are. Puspa also gave an example that Legian has 142 hotels, 132 restaurants, 350 tourism support services such as art shops, spas, karaoke places, and others, all ready to go, and ready to go until 11 o'clock because the food and drink needs of tourism at night need to be fulfilled. So let's think about those tourists. So this is another question about what comes first. Is this a health crisis, or is this an economic crisis? Or it's both, obviously. But how are we going to deal with it first? That's the issue. So if we open on the 17th, with numbers at the level that they are now, is that what we want? And is that what people coming to Bali to vacation want? Puspa claimed that the second dose of the vaccine will be completed in the near future. Well, we're at 25%, which is great news, like I said. The plan is to have it finished by the end of September. Is that going to happen? Hopefully, yeah. Should we open now before we get to that point? Well, I guess it depends on your point of view. My point of view is thinking about health first and keeping Bali open once we get open. Not opening up and then having to shut down because numbers spike or tourists get sick and the reputation of Bali gets trashed. I'd like it to open. My youngest daughter is going to graduate from school, I hope, in a few weeks. And, well, she's graduating hotel management, and at this point, jobs for hotel management, especially entry jobs, probably are not a very good option right now until we get opened up. So, yeah, I hope we open up. I hope we open up soon, but I want to open up safely. So, according to Puspa, he said that the 70% herd immunity mark, this is the magic mark, will be finished by September, and Bali tourism should be ready to go by then. And the 70% mark, a lot of countries has upped this to 80 to 90 to 95%. We're stuck on 70%. Why? Because that's the easiest number for us to reach right now. Puspa also added that in order to become more stable, in order for the situation to become more stable, small, medium, and large businesses need to sign an integrity pact. And until now, there's been no integrity pact. And so the integrity pact entails when there's a violation of the health and safety protocols, they can just be sanctioned because they've already signed this integrity pact. I thought they could already be sanctioned anyway. I'm not sure about the integrity pact. However, some players in the tourist industry say we should proceed with caution even while they want to open quickly. So one member of the DPRE for Bali constituency, Ikut Karyasa Adnanya, said that he supports opening Bali as soon as possible. However, he reminded people that before tourism is opened, the health procedures and facilities, especially hospitals, must be ready. He said this needs to be done to prevent something bad happening, when tourism is open. He said, don't let the hospitals be full and run out of oxygen. These health facilities and PROCAS, the health protocols, health and safety protocols, must be considered. So he wants also to open up when we hit the 70, and that seems to be what's going to happen, if not sooner. And he added, finally, security at the entrance, especially on land, must be tightened, no more holes. And when he says that, especially on land, he's talking about the ports, Padang Bay and Gilimanuk. So are we going to open on the 17th? Well, I'll talk about this in the wrap-up, but we've got a couple more days here of the restrictions, and then the president's going to come out with his weekly talk and tell us what's going to happen. Are we going to open on the 17th with the numbers like they are? I can't see that happening if any decisions by the government are being made based on numbers and not on the need to get the economy rolling. Okay, wrap up. Well, what about the wrap up? So we have another 2 days or day and a half, depending on when you look at this, of the restrictions, the PPKM 4 restrictions. What's the president going to do? I assume he's going to say something Monday night or early Tuesday, but I'm guessing Monday night. My guess is that they're going to be extended again, because if you look at the numbers, they're talking about before about 10,000 getting down to 10,000 a day. Now, that's still a huge amount of people. But talking about getting down to 10,000 a day, and we're still up in the 30s. It's a drop from a few weeks ago when we were up in the 40s, in the high 40s, but still got a ways to go. Now, what about the economy? Right, I'm going to talk about this article that's come out, and it's pretty critical of the way Indonesia has handled the situation, putting the economy over public health issues. But I'll talk about that on Wednesday. So my guess is that we're going to extend this another week, but we'll wait and see. For B211s, yeah, still nothing there. So if you want to come in on a B211, you're just going to have to wait. When is Bali going to open up? Well, so you heard me talk about some players want to open Bali up 9 days from now. Some say let's wait until September when we get up to 70%, the supposed herd immunity mark. I don't see this opening up really until the end of September. Now, do I want this opened up? Yeah, I want it opened up as soon as possible, but I want it opened up safely. As I said before, what's the point of opening this up? The cases spike and we've got to close it down again and put restrictions on. Thailand's having some issues with their programs opening up, numbers still going up in Thailand. So better safe than sorry, to use an old phrase that my mom used to say all the time. What about education? I talked about education on Wednesday, and nothing more on that front. There's nothing, and no reasons he's talking about opening schools. The governor's not talking about his online education, so we just have to wait on that. My granddaughter is still doing online education, which of course I'm not happy about. So maybe we'll have something more on Wednesday about that. And what about how people are responding to this situation? Well, this is coronavirus fatigue is here, and it's been here for a while. Less people wearing masks, social distancing, even in government facilities, social distancing is not really being practiced across the board. Testing, tracing, not up to numbers yet. Quarantine facilities, no. Hospitals, getting pushed to the limit. So this is the bad part. The good part is we got that 25%, and so maybe we will get to 70%. I hope we get to 70% or higher by the end of September, and that we could open in October. But as I say every week, if it was me, and I'm a cautious person sometimes, I'd be looking at December to really see things rolling again. And the other day I did an interview with an American guy who lives in the Philippines and has an interesting YouTube channel called Every Man Has a Story, and his bride-to-be has one called Every Woman Has a Story. If you're interested in seeing my interview, and it's a really long one, we're going to talk 15 to 30 minutes. I think we talked an hour and 15 minutes. Its link is up here. Okay, and so that's it for today. If you're on the island, wear a mask, social distance, stay safe, hang in there. If you are not here and you want to come, hang in there again. We will open up eventually. If you haven't been vaccinated, get vaccinated. If not for yourself, for your family, for your friends, for your community. If you don't want to get vaccinated, stay at home. Don't put the rest of us at risk. Be kind to someone today. We need more kindness in the world, especially in these times. And that's it. See you next time. Thanks for viewing. If you like this, give it a thumbs up. If you don't like it, you can give it a thumbs down. See you next time.